The narcissistic personality is a disorder of the ego structure in which a distorted self-image overrides real contact with the environment. A person with this personality type builds their identity on the need to be special, admired, and invulnerable to criticism. The environment is not a space of mutual relationships for them, but a mirror in which they constantly seek affirmation of their own greatness. This phenomenon is not limited to excessive self-love. At the core of the narcissistic personality lies chronic insecurity, a strong need for control, and an inability to accept personal weaknesses. Emotional dependence on the attention of others forms a defense mechanism that manifests as arrogance, coldness, or exaggerated perfectionism. In interpersonal relationships, the narcissist often assumes a dominant role. They manipulate, judge, and avoid closeness, as it threatens their carefully constructed self-image. If they do not receive the expected admiration, they respond with anger, withdrawal, or active devaluation of others. This is not just a defense mechanism, but a survival strategy in a world perceived as a threat to the fragile ego. The narcissistic personality is a dramatic struggle between the image of power and the fear of not being enough. It is the story of a person so afraid of rejection that they never allow themselves to truly get close. A relationship with a narcissistic person resembles an emotional roller coaster, where phases of admiration alternate with periods of coldness, manipulation, and devaluation. At first, the narcissist may appear charming, attentive, and highly committed. They create the illusion of a special connection that quickly becomes addictive. This is the idealization phase, in which the partner is placed on a pedestal, not out of love, but out of the narcissist's need to uphold their own image of success and perfection. Over time, a shift occurs. Idealization gives way to devaluation. Any form of disagreement, independence, or criticism activates defense mechanisms. The narcissist responds with coldness, withdrawal, passive aggression, or direct attack. The partner is no longer seen as an independent person, but as a threat to the narcissist, an unwelcome reminder of their own inadequacy that must be eliminated. The relationship is marked by asymmetry. The narcissist needs everything to revolve around them: their feelings, their needs, their story. The other person is reduced to the role of a supplier of attention, loyalty, and validation. Attempts to talk about feelings, boundaries, or reciprocity often end in gaslighting, reversing the situation, questioning reality, and shifting the blame. A relationship with a narcissist is emotionally exhausting. It leads to a loss of self-confidence, chronic tension, and feelings of guilt. At the same time, a dependency forms, because moments of closeness and intensity become entangled with pain, creating a toxic cycle of reward and punishment. It is not love, but a dependence on being needed, seen, and, if only briefly, idealized. The diagnosis of narcissistic personality disorder is based on precise clinical criteria and requires a thorough evaluation by a qualified mental health professional. It is not a diagnosis made based on superficial observations or colloquial labels, but rather on consistent patterns of psychological and social functioning. The basis for diagnosis lies in classification systems such as the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, and the ICD-11, International Classification of Diseases. According to the DSM-5, narcissistic personality disorder is characterized by a pervasive pattern of grandiosity in fantasy or behavior, a strong need for admiration, and a lack of empathy, occurring across various contexts and beginning in early adulthood. Core criteria include, among others, an exaggerated sense of self-importance, fantasies of unlimited success and power, belief in being special, an excessive need for admiration, a sense of entitlement, exploitation of others for personal gain, lack of empathy, envy of others or belief that others are envious, and arrogant or haughty behavior. The diagnostic process involves a detailed clinical history, analysis of relational patterns, assessment of occupational and social functioning, as well as behavioral observation. Psychological assessment tools such as the MMPI-2 or the SCID-5PD are often used to objectively evaluate personality disorders. An important aspect of diagnosis is distinguishing between narcissistic personality traits and narcissistic personality disorder. A personality trait is only considered a disorder when it is rigid, inflexible, and significantly impairs daily life, relationships, and emotional experience. The diagnosis of narcissistic personality disorder is not merely a clinical label, but potentially the beginning of a therapeutic journey. It reveals an ego structure shaped by fear, emotional deficits, and maladaptive defense mechanisms. A structure that may be difficult to change, but is not unchangeable. The narcissistic personality manifests in everyday life through characteristic behavior patterns that are often misunderstood or downplayed by others. These examples illustrate how deeply rooted the need for control, admiration, and dominance truly is. A supervisor in a company ignores their team's ideas, takes credit for others' achievements, and perceives any criticism as a personal attack. They surround themselves with admirers and publicly marginalize or humiliate those who disagree. In their narrative, they are always the source of success. Failures are blamed on others. A partner overwhelms the other with compliments at the beginning of the relationship, plans a future together, and creates the illusion of a perfect connection. Over time, they begin to exert control, criticize the smallest behaviors, and isolate their partner from close relationships. When the partner expresses personal needs, they are accused of being selfish or disloyal. Emotional manipulation becomes a tool for maintaining power. A parent fails to acknowledge their child's emotions, as the entire family must conform to their moods and expectations. The child's achievements are seen as validation of the parent's own worth. In the face of failure, the parent responds with coldness, shame, or silence. Love becomes conditional, dependent on fulfilling the narcissistic demands. A friend talks mostly about themselves, disregards others' needs, and withdraws as soon as they are no longer the center of attention. They expect constant support, but are absent when others need them. Their relationships remain superficial and short-lived, as depth requires empathy, something they lack. In all these situations, a central pattern repeats. The relationship is not based on mutuality, but on serving the ego of one individual. Behind the facade of strength and confidence lies a deep need for control, a fear of failure, and the inability to form genuine emotional closeness. The therapy of narcissistic personality disorder is a challenging but possible process that requires time, commitment, and an appropriate therapeutic approach. One of the greatest difficulties is that individuals with this disorder rarely seek help on their own. They often come to therapy due to relationship problems, professional crises, depressive states, or pressure from close others. In their narrative, the problem always lies outside of themselves. The central goal of therapy is not to eliminate narcissistic traits, but to foster emotional awareness, develop empathy, and process deeply buried emotional wounds from the past. A commonly used method is psychodynamic therapy, which helps identify unconscious defense mechanisms and understand the roots of narcissistic pain. Schema therapy and cognitive behavioral therapy also offer support by helping to change destructive thinking and relationship patterns. A key element of the therapeutic process is building a stable and authentic therapeutic alliance. The therapist must be both empathetic and firm, resisting manipulative games while maintaining the patient's dignity. Treatment may take many months or even years, and often progresses in cycles, with periods of improvement and relapses into old patterns. Family members and close individuals of people with narcissistic personality traits also need support. Their lives are often marked by emotional ups and downs, guilt, and a loss of personal identity. For them, self-help groups, psychoeducation, and personal therapeutic support can be valuable in reestablishing boundaries, understanding manipulation tactics, and regaining inner balance. Supporting narcissistic individuals and their loved ones requires patience, understanding, and clear boundaries. The treatment is not easy, but it is possible. And where the willingness to change emerges, a process can begin that allows for true transformation. Is a narcissistic person aware of their behavior? Often not fully. A narcissistic person perceives themselves through a lens of idealization and defense mechanisms that protect their fragile ego. Criticism or attempts to confront them with a more realistic self-image can trigger strong resistance, anger, or denial. Awareness can grow over the course of therapy, but it requires time and a willingness to engage in self-reflection. Can a narcissist love? A narcissist can experience emotional closeness and attachment, but the love they offer is often conditional and driven by their own needs. The lack of empathy and self-centeredness leads to the other person's feelings being ignored or used as a means to an end. It is a form of love marked by control and fear of losing power. Is a healthy relationship with a narcissist possible? Only if the narcissistic person is aware of their issues and actively works on them. Otherwise, the relationship is based on manipulation, imbalance, and emotional exhaustion. For the partner, this means setting clear boundaries and asserting their own needs, often with therapeutic support. Narcissistic personality disorder is a condition that profoundly affects how a person perceives themselves and relates to others. Behind the facade of self-assurance and the need for admiration lies a fragile sense of self-worth, a fear of rejection, and emotional emptiness. A narcissist does not form bonds, they control them. They do not listen, they expect validation. Relationships with them are asymmetrical, marked by manipulation, idealization, and devaluation. The roots of this disorder often lie in childhood, in an unstable sense of self-worth, a lack of unconditional acceptance, and excessively high expectations. Defense mechanisms such as repression, projection, and devaluation become central pillars of their identity. Treating narcissistic personality disorder is possible, but it requires long-term therapy in which trust is built, defense mechanisms are dismantled, and an authentic sense of self is gradually developed. Equally important is support for loved ones who often live in the shadow of emotional chaos and must learn to establish new boundaries, strength, and independence. Narcissism is not a label, but a complex psychological mechanism. Understanding it opens the door to change, not only in the life of the affected individual, but also in the entire relational system that forms around them.